Can I breastfeed my child and fast at the same time? If you are watching this video while being a lactating mother, I'm Dr. Owais, and today I'm going to be answering the most commonly asked questions by you. Can you fast during the breastfeeding period? Does it affect your breast milk composition, or does fasting while breastfeeding affect your baby's growth? And lastly, what steps could help you enjoy the experience of fasting while breastfeeding? So first things first, can you fast during breastfeeding? Absolutely. Fasting is totally a safe thing to do while breastfeeding your baby. You just need to take good care of your diet during the non-fasting period because that is crucial for your own health as a mother. So you might think, Doctor, what about my child? Won't my fasting affect my child's growth? Not really. Research have been done over this, and it suggests that fasting does not affect your baby's growth even if you fast during breastfeeding. So rest assured, your baby is going to grow normally, achieving normal weight and height as the babies of the mothers who do not fast. Now you might be thinking, does fasting affect the quantity and composition of your breast milk? Studies have found that there are no significant differences in the major nutrients of breast milk during and after a Ramadan fast, apart from cases of severe dehydration. The research on breastfeeding tells us that temporary fasting will not decrease your milk quantity for your baby. So be confident that your breast milk is still enough and contains everything that is necessary for your baby. Now I'll share with you some amazing tips that will surely help you with your fasting while breastfeeding your baby. Now hydration is the key. Remember, your baby will get his share of feed from your body no matter what level of hydration you maintain. And as I've told you earlier, researchers have proven the fact that unless you're very severely dehydrated, your milk supply won't be reduced. So to avoid severe dehydration, increase your fluid intake to a minimum of 8 glasses of water daily. You can also add fresh fruit juices and shakes. I keep a timer to remind myself to drink water if that helps. Now the next important thing is your diet. Your diet should contain all the 3 macronutrients: carbs, proteins, and fats. And you can eat anything from whole wheat bread to red meat, green vegetables, and citrus foods. The key is to divide them in 3 meals. That would be sahur, iftar, and dinner. This is important for your baby's healthy development. You can always add snacks. Another important advice that I always add is rest when you can. And I'll tell you why this is important for mothers who breastfeed their babies, because milk production and formation is much of a brain operated thing. Fasting can sometimes make you feel tired and low on energy. So rest a lot while you're on your fast, because that is going to help you maintain an effective milk supply for your little one. Listen well to your baby's hunger alarms. Breastfeed your baby every time they show they're hungry. This will help your baby get all the milk they need. So, how to know if your baby is getting enough milk? Here's a basic checklist through which you can make sure your baby remains well hydrated and well nourished. Check your baby's diaper. Your baby should have at least 5 soaked nappies per day. Look for your baby's skin. It should have a good tone and color. You can check that by pinching the skin of your baby's abdomen and see if the skin doesn't return to normal quickly. It could mean dehydration. Your baby should generally be happy, showing active movements of hands and feet, and generally be alert. Dehydrated babies are less active and they might be irritable and cry a lot. Check your baby's urine. It should look clear and odorless. Make sure your baby's poo is regular, soft, and is runny. And keep a check on your baby's growth parameters and muscle growth as well. If you're not sure if your child is fed well or growing well, I advise you to meet with your child's pediatrician immediately. Fasting is a choice, and I will say a healthy choice. I hope that this video might have been a help to answer your questions, and I wish you a great fasting experience and good health to your baby while breastfeeding. Now, if this video was helpful, share it with your friends and family. Keep watching and supporting. See you in the next one.